now. Good afternoon. Thanks for watching. This is Now on this Wednesday. You got Jonathan and Ashley here. We got a lot of news to get to, including a press conference that's going to happen here just moments from now from the HSTA. But first, let's get to those latest numbers being reported by the State Department of Health.
The state is reporting 647 new COVID cases today and 2 more fatalities, a man and a woman on Oahu, both in their 70s. Now, the breakdown of cases by island shows the Big Island with 87 cases, Kauai with 26, 96 cases on Maui, 1 on Molokai. Oahu logged 431 cases and 6 people diagnosed out of state. Now, as Jonathan mentioned, the HSTA is demanding that education department officials come back to the bargaining table over school safety protocols. We are awaiting their press conference, was supposed to start at around noon. And joining us is H&N Managing Editor Daryl Huff, who's going to give us some insight on what's going on. The union, Daryl, pretty upset about how school kind of rolled into play recently. HSTA says 60% of educators feel unsafe for themselves, 70% don't feel safe for the students. Now, the teachers say the biggest problem here is that social distancing, pretty impossible with their crowded classrooms, right? And there are other issues that they're concerned about too.
Right, and the response of the state has been that this is a multi-layered mitigation prevention program, right? They when they respond to these complaints, they say, wait, we're encouraging vaccines for teachers. In fact, they're technically mandating that, or tests for teachers, telling people to stay home if you're sick, which is, that's hard to do for families. Masking, hand hygiene, those are the top 4 things. And then after that, they say, they're cohorting the kid, meaning the kids aren't just running willy-nilly all over school infecting each other. They're within a small group. They have distancing, but they have admitted they can't maintain the distance, and they've increased ventilation in a lot of campuses. The way they deal with cases is they do them literally on a case-by-case basis. So a child gets sick or a staff member gets sick, they are sent home, their close contacts are contacted. So they just are basically trying to keep a lid on this case by case by case by case. And if you look at the list, they had 400 some cases in the last couple of weeks, 300 alone last week. It's usually one-off cases, right? It's like not 3 people or 4 people, it's 111. The way they did it, they put out this database that we had to rehash to get the idea of how many kids are getting sick or how many people are getting sick at each individual school. And there are schools that have 7, 8, 9, 10. But again, these are schools with 300, 400, 500, 1,000 kids in them. So, the DOE says these are manageable numbers. We're doing fine. DOH says we don't see a need to do anything drastic. But, just the last few days, 7 charter schools went to distance learning, which is thousands of kids essentially being sent home. But if you look, they have fewer cases than the schools. The charter schools, most of them have the capability of doing it.
So you guys, I'm watching right now. They're setting up for that press conference. It looks like their PR spokesperson is just setting up that room right now. So if we just bear with us for one moment as they take it full screen, we will get ready to bring that press conference to you live here momentarily. Again, we're just waiting for them to give the go-ahead to set it all up. Sorry to upcut you there, Daryl. It looked like they were a little bit more ready than I anticipated.
Daryl, were you surprised when, last week the governor and the mayors announced new restrictions on gatherings that, we saw that schools weren't affected as well as churches. And, at schools, a lot of kids, 12 and under, they're not eligible for the vaccine. Are you surprised that that happened?
No, because they are intent on keeping schools open. And there's a lot of reasons. One, it's probably better, it's more risk to a child that's not in school than of COVID in the school. That's a simple risk balancing tactic. The value of being in school is tremendous. One, you're in a safe environment, generally speaking. You are learning, you're socializing, you're running around. It's a much healthier situation for a child than sitting at home where they might get infected by a family member. So literally, the kids are safer. The teachers, that's a different story. I understand if a teacher's nervous, but if they're vaccinated, the chances that they will get particularly sick, again, risk reward balance, right? You're serving these kids. That's your job. That's your duty to serve these kids. And the teachers, don't forget, hated distance learning. They hated doing those online things. And they absolutely said, we do not believe that having some kids in a classroom and some kids at home works. And the DOE did not establish an infrastructure for massive online learning. So it's partly because of the teachers that they're not in a position that they could close the schools. So I wasn't surprised if that's the question. What I think people can look forward to now in the greater context of what's going on with the virus, we're going to see businesses more and more mandating it. And the business mandates are a lot stricter than the government mandates on their workers. The business mandates are very, very restrictive. And I think you're going to see the government called on to order businesses to vaccinate all their employees, because that takes the political heat off the individual business owner. Oh, guys, we got to do this.
Right.
Sorry. So I think you're going to see much more dramatic stuff outside of schools happening in the next few days than what we're seeing in schools.
Well, especially Lieutenant Governor Josh Green said yesterday that FDA approval of the vaccines could come within 2 weeks at the earliest.
And I was watching a Chamber of Commerce webinar today where they had all these employment lawyers, and they're saying that doesn't even matter. You could fire somebody who doesn't want to take the vaccine. You know, you can try and make a religious argument. You may have a medical argument, but the employers are being told you can do this,
Right.
and many, many will.
Yeah, and going back to schools now.
Actually, you guys, I think we just got that press conference getting started. Let's listen in.
Keith Hayashi and Board of Education Chairperson Catherine Payne a demand for negotiations with regards to changes in teachers' terms and conditions of employment for this school year. In addition, we have also sent an open letter signed by nearly 2,000 of our educators across the state, calling for decision makers to join us in finding solutions that acknowledge the reality of our current conditions as we support our keiki through this difficult time. When Interim Superintendent Hayashi started 2.5 weeks ago, he promised that strict protocols would be enforced. Yet, teachers have been expressing that this is not the case and that they are being put between a rock and a hard place. Parents are being told by Governor Ige, Interim Superintendent Hayashi, Department of Health Director Dr. Libby Char, and school administrators that their children will be kept safe. But how can teachers follow that directive when many have packed classes and impossibly little opportunity to safely distance students? In many of our classrooms, students are forced to sit side by side at desks that seat 2 students. Teachers also have little control over what students do when they arrive onto or leave campus, ride the school bus, play at recess with friends, and pack hallways when the rains come down. They're also standing in long lines in crowded cafeterias where all are entitled to free meals this year. While the department may have a health and safety guidance for schools, our students are not robots who will keep still the entire day. They are curious and carefree children who sometimes don't know of or don't care about the dire consequences that could befall them and those they interact with. And more, we're seeing schools having to shut down classrooms and quarantine dozens upon dozens of students at a time, or move children to cafeterias when multiple teachers are forced to quarantine. There are just not enough substitute teachers out there to cover for teachers who are told not to report to work. Our teachers also say protocols are being inconsistently enforced from school to school. Some administrators err on the side of caution by quarantining an entire class when a positive case is reported. At other schools, administrators only quarantined 1 or 2 students whose desks were shown on a seating chart to be directly next to a child who just tested positive. Other schools have quarantined just the positive child without identifying any close contacts. Teachers don't know whether students are gone from their class as a result of a positive result or by being a close contact. Other staff, like our counselors, constantly wonder if they worked with a student who tested positive. On Maui, teachers at one school received a list of students who shouldn't be on campus, only to find that students are sitting right there in their classes. And then there's the problem of timing. Positive cases identified on a Friday could mean that close contacts aren't notified until Monday. It's clear these quarantine protocols are anything but strict, despite what the department and our governor claim. Principals are sharing their frustrations with us and say they're juggling all of these duties without support. Officials continue to say that there is no threshold that will be too high for our schools to move to safer measures that aren't spelled out in the health and safety guidance. Our hospitals are full. Cases in Hawaii are astonishingly higher than ever before. The Department of Health's own community transmission for schools infographic shows that every single island lists community transmission levels at the highest possible levels. What will it take for those in power to come to their senses and realize that schools are not safe spaces they purport them to be? Our teachers are trying their hardest to keep their students as safe as possible, but it's a Herculean task that has been placed upon their shoulders, and the frustration is overwhelming. And what recourse is there? The Department of Education holds all the cards. As of yet, they refuse to negotiate protocols to address the impacts on the working conditions of our educators who are forced to choose between jeopardizing their health or jeopardizing their employment. It's a slap in the face from a department that touts teacher voice and teacher collaboration. Our teachers are crying out for this insanity to stop, for the department to live up to their word and be truly accountable to what they are telling the public is happening in our schools. It's hypocritical of the governor to limit indoor social gatherings to 10 or fewer, but allow class sizes in the upper 20s, 30s, and even into the 40s. It just does not make sense. Last year, we had a memorandum of understanding that allowed schools to switch to alternative modes of instruction, including distance and hybrid. But the state refused to bargain a new MOU for this school year, insisting instead that all schools would return to in-person learning with very limited alternatives. This poor planning means that there are no set provisions for distance instruction and no guarantees of key health and safety protocols. Enough is enough. We need the department, the board, and the governor to work with us so we can all truly ensure the safety our students deserve. Some of our charter schools are already making the wise choice to move to distance learning. If the department wants to do something similar, especially in areas where transmission is greatest, they need to work with us to negotiate these impacts. Tomorrow, our members will tell the Board of Education what is really taking place in Hawaii's public schools. Our teachers demand nothing less than coming to the table and working out how to best move forward, given the runaway numbers as the Delta variant ravages our communities and spreads among our children like never before.
All right, that's the HSTA president talking there. Daryl Huff, just bringing him for one more moment. What are your takeaways from what he was saying? He had some harsh words there for the governor, I would say, calling him hypocritical.
Very harsh words, and also insanity. Teachers are crying out for help and so on. He basically said that students are in jeopardy, as opposed to just talking about the teachers. As far as where this goes now, though, by demanding for negotiation, the governor may invite them to the table, or the school board may invite them to the table, but actual hard negotiation of a MOU or a memorandum of understanding is going to take longer than the current surge of cases. But, this is politically challenging for the governor and for the Department of Education. That's why they're going to take this to the Board of Education tomorrow. But ultimately, I think the state's answer to this would be, we believe the schools are managing with a reasonable amount of risk for the reward of keeping the kids in school. Finally, I think that the real crucible, the real moment is going to come Friday. Late Friday afternoon is when the DOE puts out its case counts. And if it's accelerating at the rate the last 2 weeks were accelerating, if you've got 1,000 cases in the schools, I could really see them taking some action, but on their own, not necessarily because of what the HSTA is saying.
All right, if we look at today's case count, yet again, 647 new cases. We also got some other news, and I want to thank Daryl Huff for joining us today on This Is Now. The other news being President Biden just spoke moments ago about those booster shots. I want to get the update on that. Here's Deborah Alfarone.
President Biden is taking on Republican governors when it comes to mask mandate bans in schools, directing his Department of Education to step in.
We're not going to sit by as governors try to block and intimidate educators protecting our children.
The Biden administration has formally announced plans to distribute COVID-19 booster shots for adults, 8 months after they've received their second dose of the Pfizer or Moderna vaccine.
Pending FDA and ACIP approvals, boosters will be available starting the week of September 20.
We are concerned that the current strong protection against severe infection, hospitalization, and death could decrease in the months ahead.
Newly released studies suggest the effectiveness of the two mRNA vaccines against infection drops over time due to the rapidly spreading Delta variant. Despite the summer surge of new cases fueled by the unvaccinated, the Biden administration will reach a new milestone by the end of the day. More than 200 million Americans with at least one vaccine dose. In an effort to push even more Americans to roll up their sleeves, President Biden is directing HHS to come up with new regulations requiring nursing homes have all staff vaccinated in order to receive Medicare and Medicaid funding.
If you visit, live, or work in a nursing home, you should not be at a high risk for contracting COVID from unvaccinated employees.
The Biden administration is also extending 100% federal reimbursement for states who mobilize the National Guard in their COVID-19 response efforts. Deborah Alfarone, CBS News, Washington.
Hospitals across the state are reporting having ICU units at or above capacity. Casey Lund spent the morning talking to local healthcare officials to get a status report. Casey, who'd you talk to today?
Yeah, Jonathan, so we talked to Queens, Hawaii Pacific Health, we talked to Kaiser Permanente, Maui Memorial Medical Center, and Adventist Health Castle. So we really ran the gamut and talked to a lot of people. And I want to play a clip from Andrew Giles from Kaiser Permanente just about how serious the situation is there and what they're seeing.
This Delta strain, compared to previous strains, is infecting younger folks. They're much sicker. And it's quite sad, frankly. I think if people have walked the units and see the things that I see, 20, 30-year-olds on ventilators, it's quite a disturbing scene. And I think that really just puts emphasis on taking this vaccination seriously.
And yeah, Jonathan, that was really the consensus with pretty much everyone we talked to. Obviously, which we've been talking about for a while now, is the experience between those that are unvaccinated versus vaccinated is very different.
Yeah, that's certainly the case. And you also talked to some outer island healthcare officials, right?
Yeah, we talked to the CEO of Maui Memorial Medical Center, Mike Rembis, who had something similar to say.
It's devastating. I don't think people realize just how bad it is. Of our 33 patients in the hospital right now, 12 are between 20 and 40. We had someone struggling for their life at 30 years of age with young children at home. All avoidable had they been vaccinated. Right now, out of the 33 patients here, only 3 of them are vaccinated.
So, Casey, in all the talks you had today, there was a little bit of good news, right?
Yeah, in our conversation with Hawaii Pacific Health, Dr. Melinda Ashton, told us that they are starting to see their numbers slowly go down. They are still expecting some extra help coming in from the mainland, like a lot of the healthcare providers we talked to. They are getting some nurses and other staff. But Dr. Ashton had some really good advice for folks that are returning residents from the mainland.
I think, we're hearing over and over again from people coming back saying, hey, I was in, fill in the blank, Nashville, Las Vegas, wherever, and nobody wore masks. If you were in that situation, please stay home for, until you can get tested. Usually day 3 to 5 after you return is a great time to get tested and just see if you were safe during your travels.
All right, Casey Lund, thanks for that reporting all morning long on Sunrise. Let's toss it back over to Ashley for more news.
A judge could decide as early as today if 3 Honolulu police officers should face a trial for the shooting death of a teen robbery suspect. At yesterday's hearing, new surveillance video was played showing the stolen car driven by 16-year-old I Remember Saikap moving forward and back, then forward again after it was cornered on Kalakaua Avenue. Prosecutors say no one was in front of the car when it was moving, and therefore there was no need for officers to shoot. But the defense argues officers shot and killed Saikap because the car could have hit others. They questioned Lieutenant Brandon Nakasone from HPD's Professional Standards Office.
Obviously, this all happened very quickly, correct?
Yes.
In a matter of seconds, it was done, yes?
Yes.
Now, in your training and experience, does somebody have to be right in the middle front of a vehicle to be in danger from that vehicle?
No.
Would you agree that even towards the front side, front driver's side, front passenger side, right next to the side, that around a moving vehicle there is a zone of danger? Would you agree with that?
I agree with that.
Today's hearing is scheduled to begin at 1:30 p.m. We'll have the latest online and on air starting at first at 4.
All right, we want to take you live outside now to get a check of that hurricane forecast as well. It looks beautiful right now, but things could be changing for your weekend. Here's Billy V with more on that.
Happy Aloha Wednesday. Here's your forecast. So first of all, we'll talk about Hurricane Linda. It is a Category 2 storm. We were expecting it to be Category 1 today, but it strengthened over the last 12 hours or so, so still a Category 2. Winds right now, 105 miles per hour, and the gusts are moving at gusts up to 125 miles per hour, moving westerly at 13 miles per hour. So let's put this in motion. We'll show you what we're expecting here for the next couple of days. By tomorrow, we're hoping it will be a Category 1. By tomorrow afternoon, it will move into the Central Pacific region. And with that, we look forward. That's a tropical storm, and then we're expecting it to go to a remnant low by the time it reaches over the Hawaiian Islands, which is expected Sunday. So Sunday and Monday, we're expecting some possibly heavy showers. A lot of that moisture is going to get caught up in the trade wind flow, or it could cut off the trade winds, and those showers could just stick around and stay in those areas, and that's when flooding could possibly happen. So we are watching it here on your severe weather station. Let's go ahead and show you what the surf is going to be like too, because that east-facing shores could get some of that Linda energy there. 3 to 5 feet today, 7 to 10 feet over on the south-facing shores, and that's why a high surf advisory is in effect for those shorelines all across the state. And by the way, those are dangerous conditions if you're not used to the water, so check with lifeguards if you're just visiting us here in the islands. And finally for you, we have the forecast 7 days. So today, of course, no trade winds, light and variable winds. We have some sunshine, but we have some also afternoon showers over the interior sections and leeward sides. Then we get the trade winds back for Thursday, Friday, Saturday transition, and Sunday, Monday, possibly heavy showers due to Hurricane Linda. Get the latest on air, online, on your mobile device, and at HawaiiNewsNow.com.